My name is Dan Pitchinson. I'm the Executive Director of the Ryan Chelsea Clinton Community Health Center. We're located at 645 10th Avenue between 45th and 46th Street in Hell's Kitchen on the west side of Manhattan. Thank you for taking time today to be part of our discussion. We're very, very excited. August 9th through August 15th is National Health Center Week. And this week, each day of the week, we're highlighting a virtual workshop around health and social services to help cope with the pandemic. So thank you for taking time to join us. So today at Ryan Chelsea Clinton, we're very honored to have Senator Brad Hoylman, who's speaking in a moment, Dr. Zara Siddiqui, who's part of our panel. She's the medical director, and also Judy Rosenfeld, who is a licensed clinical social worker from our Schoolbased Health Center located at the Park West Educational Campus, just a few blocks from here. Before we kick it off, I just want to say is that health centers are one of the fabrics of the social service delivery system in our country. We provide high quality, low cost healthcare to over 25 million Americans from coast to coast. Based on our mission, we provide care regardless of people's inability to or ability to pay, a very aggressive fee scale. We also work with an independent pharmacist in our neighborhood. So if people are prescribed medications that are costly, we're able to provide them at a discounted rate. So we're really here. We provide primary care, specialty medical care, optical care, dental care. We do for adults and for pediatrics. So Dr. Siddiqui and Dr. Rosenfeld and Senator Homan will be talking about the importance of vaccinations and back to school in this very, very interesting time period. So thank you very much for taking time. So I'm gonna introduce Senator Hoylman and thank him for joining today's webinar on preparing families to return to school. Senator Hoylman is a great friend of Ryan Chelsea Clinton and Community Health, and we're grateful to have him today. In the Senate, he champions a wide range of issues, including housing, transportation, public education, LGBTQ rights, the environment, and seniors. He led the fight in the state Senate for passage of the Children Victims Act, which enables adult survivors of child sexual abuse to revive legal claims against their abusers. During the COVID-19 pandemic, he's worked hard to ensure healthcare providers in his district have the resources that they need. I'd like the viewers out there, in the very beginning of the pandemic, when we were looking for PPE, for equipment to protect ourselves, Senator Hoylman and one of his aides showed up in a yellow cab, and we were socially distanced, and he brought us 30,000 surgical masks. It was a very difficult time when everybody in the world was searching for equipment, and that he was able to deliver to our front door. I cannot express my appreciation enough. So in addition to being our senator, he is a staunch advocate of science-based health policy to combat vaccine preventable diseases. And I'm sure Dr. Siddiqui will cover this. During the pandemic, the New York City Department of Health is reporting that administered vaccine doses are down as much as 63%. And from a public health perspective, we don't want our young children getting sick from other diseases. So with that being said, I'm going to turn it over to our good friend, Senator Brad Hoylman.
Well, thank you so much, Dan. I really appreciate it. And I just wanted to give a shout out to my colleague. The aide you mentioned is Maya Burlow. She's on the line with us. She helped me deliver those 30,000 face masks, as well as a constituent of ours named Lily Fan, who lives in Chelsea. She made the donation and wanted to make sure that health centers like yours, which are so crucial, especially now, had the PPE, because without your workers on the front lines confronting this pandemic, we'd be far less well off. And we're beating the virus, as we know, in New York with transmission rates of less than 1%. And that's because of your hard work and all the frontline workers and your colleagues, your staff, your physicians, your administrators. So thank you from the bottom of my heart. We're not banging our pots and pans every evening at 7 p.m. like we were earlier in the pandemic, but I want you to know that in my heart it's beating constantly for all of your great efforts. And so you know, thanks to Michael and Dr. Siddiqui for putting this together. It's so important that our families know how to keep their kids healthy during this time. And I'm really pleased to speak about the importance of childhood vaccinations. I'll add that I'm currently in a vaccine trial right now. I signed up to volunteer for the COVID-19 vaccine trial that's underway at NYU Langone Health. And I took the shot on Monday, so I'll be reporting back, and I report daily through a phone app on the, you know, any side effects. But so far, so good. And I'm hopeful that with more New Yorkers participating in this vaccine trial, we're such a perfect place because we have higher than average risks, and we're a very diverse population, and that's the kind of population, as I understand it, and the Dr. Siddiqui knows far better than I, make a good vaccine trial. But you're right. Vaccines prevent so many illnesses that make our kids sick and affect their long-term health, and have done so in the years prior to them being available. And that statistic that you relayed about childhood vaccination rates plummeting up to 63% during the pandemic, it's up to 91% for children older than 2 years old. And the recent data from New York City indicates that some of these rates are beginning to rebound, though the rates for kids older than 2 are still 35% what they were a year ago. You know, we understand many families are staying home during the pandemic. They may be wary of physicians' offices. But if there's a schedule that needs to be, you know, followed, they can safely visit health centers like Ryan Chelsea Clinton to keep their kids' vaccinations and physicals up to date. And as so many parents know, there is this regimented schedule that needs to be followed in the first years of life for children's vaccinations to eradicate these diseases that have plagued society for centuries, literally, before they were discovered. Polio, measles, mumps, rubella, chickenpox, and so many others. And as you're going to hear in this webinar, the New York City Department of Education is requiring students to be up to date with their vaccines and have their annual physical and vision exams as they return to school, and whatever form that may take. Ryan Chelsea Clinton and other providers have school-based centers where students in need can be vaccinated. So thank you for that work. And to everyone listening, you can visit the New York City Department of Education website, schools.nyc.gov, and search medical requirements to see what physicals and vaccinations are needed for your kids. But visit your local provider, Ryan Chelsea Clinton, to have your child ready and healthy for school. There's a lot of uncertainty in the world today, Dan, including, you know, what school is going to eventually look like in the fall. But one thing we can be certain about is if our constituents and our clients stay up to date on their vaccinations, their kids, and the society at large is going to be better for it. So thank you so much for giving me a few minutes to make the plug for vaccine efficacy, safety, and public health.
Thank you, Senator Homan. I have a son who's going to be entering second grade at PS 384Q, and you know, he's gotten to know the schedule himself. He'll say, "Daddy, I'm not getting a shot this time. I know it's not this time.
Yeah.
It's the next time." So, they themselves get to know.
Yes.
But thank you for your very kind words and your strong advocacy and leadership. And at this time, I'm going to turn it over to Dr. Zara Siddiqui, the Ryan Chelsea Clinton Medical Director. Dr. Siddiqui.
Hi, everybody. Thank you so much. Those are really great words from both Dan and Brad Homan. I believe Charlene has a presentation to get started. She's going to go a little bit over RCC, and then let's jump into Ryan Chelsea Community Health Center, and then let's jump right into the vaccines.
Hello, I'm Charlene Kaloki. I am the Community Relations Coordinator over at Ryan Chelsea Clinton. I'm going to go over a brief history of Ryan Chelsea and then jump right over into speaking about pediatric vaccinations with Dr. Siddiqui. So as we mentioned before, right, so Ryan Chelsea Clinton, been around since 2001 in Hell's Kitchen, located at 645 10th Avenue. And we believe that healthcare is a right and not a privilege. And we strive to make sure that everybody has accessible access to affordable healthcare in our neighborhoods, as well as at all the sites and places that we serve. So a bit about our panelists. So Dan Pitcherton spoke earlier. He's our executive director. We had Senator Brad Homan, Dr. Sarah Siddiqui, and Judith Rosenfeld from our School-Based Health Center. A bit about our history. So Ryan Health in general has been around since 1967, and we were established pretty much to serve the community with affordable healthcare services. We currently have over 50,000 patients enrolled across our sites. Our mission is that we are dedicated to providing comprehensive, linguistically appropriate, and culturally competent healthcare services to medically underserved populations. And we aim to ensure that all of our patients are treated equally with dignity, respect, courtesy, confidentiality, and concern for safety. And this is actually a picture from the donation that we mentioned earlier with Senator Brad Homan, Dr. Siddiqui, one of our nurse managers, as well as Dan Pitchinson. Yes. And as we mentioned earlier, it is affordable to all people. So we service all patients regardless of their ability to pay. We accept Medicaid, different managed care plans, and most private insurances. And for those who do not have health insurance, we also do have a sliding fee scale available for them. And then here are updated hours of operation. You can find this information on our website as well. We will be starting our Saturdays, starting our August 22nd from 9 a.m. to 1 p.m. And then our next presenter is Dr. Zara Siddiqui, who serves here at Ryan Chelsea Clinton. And she's gonna be speaking a bit about pediatric health and vaccinations.
Hi, everyone. I'm so excited about talking about vaccinations. It's a topic that's near and dear to my heart. It's because vaccines have saved so many lives throughout the years, hundreds of years of medical conditions. We're lucky to be able to have vaccines to help protect against them. So let's go on to the next slide. So one of the things that's different in COVID, in times of COVID, or what I call COVID times, is that we're able to provide telemedicine. So a lot of families are maybe concerned about coming into the health center or prefer to be here for a short period of time. We can do a telemedicine visit, talk to the parent about medical issues, and go over any updated vaccines, order them, and then the patient and child can come in and have the vaccines done. And there's no added cost to that. It's very simple. I can send you a text, click on the link, and I'll be on the other side of the video, or log in through the email. So here's a little bit about vaccines. So I wanted to talk about why vaccines are important. As I mentioned earlier, vaccines prevent disease, and there's nothing better than preventing a disease rather than getting it and having to work on the cure. And we have lots of vaccines. They start at a young age, starting as soon as a baby is born, then at 2 months, and then at a regimented required schedule by the CDC along the way. And it's really important to follow this schedule because it proves the most likelihood of getting the proper immunity and not having too many vaccines at one time. And also another thing that's considered is when a child is likely exposed to a certain disease. If you're following the schedule, you're getting it at the right time, right before it's at age risk for the child. And now during COVID times, we're talking a lot about COVID. I think it has a different importance now too for me and my patients. Right now, a lot of us are worried about when someone has a cough, a cold, symptoms, or fever. Is it COVID? Or it could be something else. It could be the flu. It could be other medical things like an ear infection or meningitis. One of the things that you could be sure about is that if you have the vaccine, it's less likely that it would be something else. And you don't have to worry so much about what are we trying to figure out, what is causing the fever. So going through quickly, these are a lot of big words here on the chart of the different vaccines that are there. But quickly, there's the diphtheria, that's whooping cough. That's a common cough. That's a really, really bad cough. Kids cough so hard that they're unable to breathe well. Tetanus, that's in case someone accidentally cuts themselves. There's bacteria that can get into the bloodstream and cause a very bad infection that could lead to death. Polio, something we don't see at all much now, about 50, 60 years ago was much common, and that led children to have long-term disabilities with using their arms or legs. It's a disease that affects the nerves. Measles, mumps, rubella, there's been a few pockets of outbreaks here and there, but these are all viral illnesses that cause a rash, really bad fever, and can cause birth defects in people that are pregnant. Hepatitis B, that's an infection of the liver. It can be lifelong, or it can be cured on its own. The chicken pox, this is something we used to get my generation, but children aren't getting as much. It's another one that it takes, when children are sick, parents are out of work to stay home, school is missed, it can cause a lot of issues. So preventing these diseases really has a comprehensive effect on overall health, education, and even finances for a family. Meningitis, this is the one that starts in a little bit older kids. The hospitals, they used to be full of children with meningitis, and many would pass away. And now that we have this vaccine, we see less and less children. It's actually rare to see meningitis now. Haemophilus influenza, that's a common bacteria that causes ear infections. Same with pneumococcal pneumonia vaccine. This helps preventing pneumonia and ear infections in young children. And influenza. So every year the flu is different. In some years it's tougher. It can affect the younger kids with asthma. So getting these vaccines, you're doing two things. One, you're protecting your child, and then you're also potentially protecting the children of the neighborhood and the children of your community. So it makes a difference. The more people that get vaccines, it makes a difference. The school requirements, these here are the same as the school requirements. The only thing that I would add is that for childcare, they do require the flu vaccine, at least one dose, and that's really important to be able to be, for a child to be able to enter into childcare. Okay, so let's do the next slide. And so this is a good slide that shows what most of the how the disease is spread. As you can see, a lot of them are airborne. And those of you who have kids know what do kids do when they get to school? they touch each other, they breathe on each other, they cough on each other, they sneeze on each other. Don't know what to expect this coming year. There might be mask requirements. I think it's still up in the air what's going to be happening in school. But the important thing to know is that these things are really contagious, a lot of these diseases, and it's really hard to provide barriers for kids from not to get it. So that's why a vaccine is so important. Okay, go on to the next. This is another immunization schedule. We have these at Bryan. If you'd like a handout, this is a really good diagram. Let's go on, and this is just another version of seeing how it is. And what you can see that's different here is there are recommended doses of vaccines for high-risk children. So if your child has, let's say, another medical condition like asthma, then it's good to check with your doctor that they may need different set of vaccines or at a different schedule. So it's very important to speak with the pediatrician. Okay, so now that school's coming back, we're also talking about what's going on with school sports and school physicals. You can get your school physical. There's still plenty of time. Many schools don't allow a child to enter school without the school physical. And the question is, what's going to happen about sports? Sports physicals are important, especially for those children that are going to be participating in sports. One of the things we want to make sure is a child safe to play sports? And we screen for a particular heart condition that can affect children when they exert themselves. So it's important to check with your doctor if your child's participating in any sports. And always important, especially now, to remember to wash your hands and use universal precautions when necessary. Okay, so here's some CDC guidelines. If you're sick, stay home, don't join in the sports. Bring your own equipment if possible. Wear a mask if possible. Reduce physical closeness and keep 6 feet of space between players when possible. Players should clean their hands before and after practices, games, and sharing equipment. And tell the coach or a staff member if you don't feel well. And this is really, really important because sports are important. Exercise is really important for children, but we want to make sure that it's done in a safe way. And now I'm going to hand this off to Judy Rosenfeld, who works as a social worker at Park West High School. And she's going to speak on mental health services.
Hi, everybody. So you got to hear from Dr. Siddiqui about taking care of the body and how important it is to take care of your body, especially now, this time that we're going back to school. And I'm here to talk to you a little bit about what you need to do mental health-wise to take care of your mind, emotions, social. We all know how important it for our kids to be social. They thrive in social settings. Where you stand now, wherever you are in terms of going back to school, whether you're going to do all telehealth or remote or a hybrid, I want you to think of a few things and prepare yourself with a few things while you get yourself ready back to school. So next slide, please. Okay, I want to start by just saying that I am a mental health provider. And we all know that it takes a village to raise a child. And I want you to be able to take advantage of this opportunity that you have. You live in New York City, and if you are affiliated with RCC, Ryan Chelsea Clinton, and if you go to Park West campus where there's 2,000 teenagers, then you have this opportunity to be part of RCC, part of the school, and part of the school-based health center. There is no reason why every person, every family that is in the school should not be registered with the clinic. And in order to receive mental health services from Ryan at the clinic, you need to be registered. But being registered means that you could get your annual physical, you can get your immunizations, you can get your flu shot, You could, if your child is getting medication, you can have medication. If your child is not feeling good, instead of sending them home, they could send them to the clinic first and see what's going on. So it's like having a parent on site all the time. So I highly recommend that every family register at the School-Based Health Center. And to see me, one of the therapists, as a mental health provider, you need to be registered, and it's very easy to register at the clinic. Next slide. Thank you. Okay. So there is also emotional wellness center. Mental health services is so important. It's always been so important, but today with the climate that we're in and where the whole world is under an enormous amount of stress and anxiety and depression and every possible mental thing that you could think of, you should know that there are emotional wellness centers all over the United States, but Ryan has them all over New York City, and please take advantage of that. Thank you. Next slide. Okay, so wherever you are on the spectrum of where you're sending your children, there's a few things that I wanted to talk about because I think that that's important for you to start getting yourself ready. Before I even mention that, I just want to thank you for coming. And also there's two things that come to mind. One is how important it is for you as parents to take care of yourself. But because before you take care of your family, you need to be taking care of yourself. So make sure during this time that you take care of yourself. The other thing that comes to mind all the time when I think about parenting, and especially during this time also, is the good enough parent. So we all know that we want to be like the best parent and the perfect parent, but I think it's important that we just take a deep breath and remember to breathe all the time and slow your breath down. And remember that it is the good enough parent. The good enough parent is pretty darn good, and especially during this time. So a few things I want to mention. During this time, I see probably most of my students, I would probably even say all of them, are on a different schedule since the pandemic happened and through the summer. A lot of them stay up all night and then sleep all day. Their schedule is all mixed up. And I just want to let you know how important it is to start your children now, to sit down with them. Teenagers want to be part of the solution. They don't want to be told what to do. They want you to include them, but let them know, remind them how important it is for them to get enough sleep. If they do not have enough sleep, they cannot thrive in school. They can't be well prepared if they're not getting enough sleep. Now is the time to start them adjusting. Now is the time to sit with them and ask them and discuss with them and come to an agreement. When is a good time for them to go to bed? Limit their electronics for sure at night so that they could be well rested and then start the day and start school, whether it's on Zoom or in person. They will, if they're much more well rested, everything else is so much easier. The other thing that's really important is family time. And when you're dealing with adolescents, they tend to resist and they tend to fight you and they tend to want to be with their friends, but it is so important to have family time. Whether now during the pandemic, it's so much easier to be together because you're stuck together anyway. Don't forget that stuck together feeling. And if you can have dinners together, every study shows how important it is to have meals together. If you could spend some time doing something that your teenager likes to do or your family likes to do, and make sure that you laugh during this crazy time. I am giving you permission to laugh. Please have fun, laugh. We're not meant to be serious all the time, even though this is a very serious time in our lives. Be available. Please send texts to your children daily, weekly, not more than once a day, I would think, but let them know that you are around. Check in with them, ask them how their day is, ask them if they're excited, not excited, have discussions with them. You as your child's parent you are the #1 advocate for your child. Don't give up that you have this window of opportunity before they become 18 and they're full-fledged adults, that you are responsible for them. Please take it seriously, be an advocate for them, know them really well so that you could get them whatever needs that they want. And then coping skills. It's really important for them to have coping skills. It's important for them to learn how to breathe properly, to take it slow, to be mindful. Next slide, if there is one, or is this it? So okay. So you know what, we're going to skip ahead because I pretty much discussed most of this with you. The family time, just reviewing with you, be available, coping skills. And I guess the last of the scoping skills, the most important ones, by the way, are like the journaling, making sure that they have somebody that they could speak to, making sure that every person on this planet will be experiencing stress at some point in his life. And this is an extremely stressful time for everybody in the world. So know that you're going in, you are not alone. And if there's so many points that we're giving you today, one of the really important ones are that you are not alone. And my job, this is my job, is to help you, to support you, and to help your child. And if there is, for any reason, you feel like your child needs extra help, they need somebody to speak to, they are struggling with depression, maybe suicide thoughts, maybe anxiety, maybe just stress, or maybe just the like transition going back to school and you need some help, please reach out to me. I could be reached. We're going to go to the next slide. Okay, before we go to the next slide, I can be reached at, I'm gonna say my work cell phone. Please text me, call me. If you even just have any questions at all, at anything that I said, it's 646-418-5688. And now we will take some questions from the audience. Thank you.
Okay, so our first question is actually how early can parents bring in their kids for vaccinations?
Yes, so I'll take that one. Vaccinations are set at a regimented schedule. They actually start at newborn age. So right when a baby is born, before they leave the hospital, they get a hepatitis B vaccine. And that's shown because it shows, it's proven that there's longer lifelong immunity to hepatitis B. After that, the first year of life is safe to say it's every 2 months. So we have the newborn visit, then a 2-month visit, 4 months, 6 months, 8 months. And then there's then there's the 1 year, and then the 15 months, and so on. So if you're not sure, I think as soon as possible, you want to check with your doctor if you think you're missing a vaccine. If you are, if you're not sure, the school will let you know right away because they want everyone to have their vaccines before they allow children to enter. Yeah, so no, there's no time that's too soon.
Awesome. Okay. And all right. Next question is what age range do our mental health services cover?
Oh, that's a good question. So I am the mental health provider at Park West, which is a high school, but I have colleagues that are mental health providers from kindergarten through, through like I do the high school, but you can also start, depending on which school, they can start as early as pre-K.
And then switching back to vaccines, what vaccinations are available at our school-based health centers?
Hi. All of the vaccines that are required for school-aged children are available at the school-based health centers. And we participate in a VFC program, meaning that there's also free vaccines for children if needed. And as long as, like Judy Rosenfeld mentioned, you want to have the child registered to the clinic or to this school-based health center so that you can receive vaccines there. And it's easy. The kids don't have to miss much of school. They have an excuse. So it's a great system to use.
And then what would somebody do in the case that their child has missed one of their scheduled vaccines during quarantine?
That's going to come up a lot. There is a catch-up schedule. If you check the CDC website or the New York City District of Health, it's important to talk to your doctor. The doctor will figure out a catch-up schedule. There are a few vaccines that once you've missed the window, there is no catch-up for it, but that's not a reason to worry. It's just that at a certain age, certain medical conditions are not a worry. For example, rotavirus, which is an important vaccine for children to get between the ages of 2 months to 6 months, because it causes really, really bad diarrhea. Children could actually pass away from it. But if you bring in a child that never got the vaccine at the age of 1, it's no longer needed because it's not a risk, and it's not as much of a concern. But there is a catch-up schedule for any of the serious medical conditions that need, if a vaccine is missed.
And then a follow-up question to that is, what is the cutoff age for pediatrics, and when is the right time to stop vaccinations?
So I'll answer the second part first. Vaccinations are lifelong. We got them for life. Tetanus vaccine is every 10 years. At the age of 65, I guess I would say the pneumonia vaccine. That's one of the last vaccines. So everyone needs a booster at age 65. There's also the shingles vaccine that's recommended started at the age of 50. So you're never too old to get a vaccine. And the first part of the question was pediatrics. Most recently, most insurances they cover, so you could see a pediatrician until the age of 21. We also know that up until the age of 25, 26, the brain is still developing. But specifically at our center, between the ages of 18 and 21 is when some of the kids, they have to leave our pediatrician, Dr. Hassan, who they've been with their whole life, and they graduate to seeing a new adult doctor.
It's very informative. Next question is counseling available for children who are learning at home?
Absolutely. Yes. Since the pandemic started in March, when DOE closed, we went automatically on telehealth. And all of the students that I see now, I do via telehealth because schools are closed. And I usually use, there's so many different modalities, but we can figure it out. Absolutely. Definitely. Thank you for reminding me.
And then following up to that question as well, is there any sort of consent or anything needed for parents or for any students who are interested in receiving services from you?
So when you register at the clinic, you're also signing a consent that I can see them for telehealth. And the ideal situation is that we're all involved, and but anything that the student tells me is held in confidence and everything is confidential. But I do work with parents and I do work with teachers so that we could address whatever issues are involved.
Awesome. Okay, thank you. And then for both Dr. Siddiqui and for Judy, do you have any I guess like answers to commonly asked questions from new patients who might be seeing you either at School-Based Health Center or coming in for a pediatric visit?
Okay, let me think about those. So right now there's a lot of questions about COVID. It is kind of the topic for the last few months. The pediatric and multi-system inflammatory syndrome, when that was first reported, I know a lot of parents were really concerned about how to look out for that, and were concerned if their children would be at risk. So I do cover that quite often. One of the things I say is if the child has had a fever more than 5 days, that's definitely a reason to call your doctor. And if the child is seeming very, very ill, to go to the emergency room right away. Actually bypass your doctor's office and take them to the emergency room. And then I'll let Judy answer the next one while I think of another common question.
Okay, so I think the thing that I used to get the most is that there are a lot of parents that are hesitant to receive mental health services because they are nervous and they're scared, and they don't believe in therapy. But I think mental health services is so much more than therapy, and it's just basically when parents realize that my job is to help them, support them, and if their child is emotionally and socially better, feel better about themselves, then they will do much better in school. And when they get that, then it's so much easier for them for all of us to be on board. You know, my job is never to tell anybody what to do. And my job is not to tell anybody else's business. So everything that's said to me is kept in confidence. And my job is just to help kids thrive. And students that come to me, all of them report that they are happier, healthier, feel better about themselves, feel better about the situation that we're in right now. And we work on coping skills and tools so that they could really do well in school and in life. Thank you.
And then, oh, do you mind if I switch over to Dan really quick and then come back to you?
Yeah, sure.
Okay, awesome.
I'm sorry, I just wanted to address the issue of parents and of patients who are coming to our center and feeling safe given the pandemic. So the health center has undertaken several actions to protect you and protect your families. So everyone who comes into the center is required to wear a mask. Upon entry into the center, you go through a quick screening that would help identify potential risk. You also there's a thermoscan, so there's one of those electronic thermometers that helps take people's temperatures. All of our areas of the center are going through deep cleaning at a much more regular cycle than we had before the pandemic. All of our staff have been trained on proper hand hygiene. We are constantly monitoring the cleanliness of the center. We're constantly reminding people about 20 seconds, making sure that all of our hand sanitizer stations are full. We also have in our waiting room created the ability for people to sit but also be 6 feet away from each other, so we're able to promote social distancing. Also, if there's areas of the clinic, we have visual cues. You may have seen them in stores or other areas where it reminds you where to stand so you're not within 6 feet of another person. So we really take your safety very seriously. And a friend of mine has said, "Oh, do you feel nervous that you work in a health center during the COVID pandemic?" And I said, "Actually, I feel like being in the health center is one of the safer places I can be, given all of the precautions that we've taken." So I would encourage you to come to the health center, because we have really taken to heart to ensure that your safety is our number one goal and the safety of your family. Thank you, Charlene.
And then Dr. Siddiqui, did you want to add a few more comments on pediatric visits?
I was just thinking of another commonly asked question. And I think a lot of parents are struggling with a decision because their schools are giving their options, either to send the child to school or to continue at home. And I get a lot of parents asking that question. Usually my response is similar to Judy. I'm not going to tell you what to do. You have to make your decision. But some of the things you want to consider is, how is your child done throughout this period with school from home? If they're doing well, if they were able to thrive during this time, then that's something to consider. You could keep them at home. But every child is a little bit different, and they're different type of learners. And some of them need that socialization, and they need that opportunity to be at school. So I think those are some things to consider when making the decision, if your school is offering that to continue homeschooling or to go to send the child to school. And of course, there's other factors at play, like the parents need to work during the day as well.
Awesome. Okay. Yeah. So it looks like those are all the questions that we have at this time. Just wanted to say thank you to all of our panelists and presenters today. So thank you, Judy Rosenfeld. Thank you, Dr. Siddiqui. Thank you, Dan. And then thank you to Senator Brad Holman's office as well. It's been really great to host this live and this webinar for National Health Center Week for us. If you have any more questions or need more information on Ryan Chelsea Clinton, on our services, you can find that information on our website. So at www.ryanhealth.org. And you can also be able to find our panelists from today. You can also book an appointment on there and find out more information on our patient services. All right. Thank you everyone for joining. All right. Bye.